Good afternoon, everyone, and welcome to the weekly Independent Sage briefing. My name is Alok Jha. I'm a science journalist. Recent data suggests that vaccination rollout has reduced hospitalizations and deaths across the UK. Fewer infections mean fewer deaths compared to last winter. To tell you more about this, Dr. Kit Yates has downloaded all the latest data, and he's going to kick off today's briefing with a quick analysis of what he thinks is happening with the spread of the coronavirus right now. Now, having lived with the pandemic for more than a year, the negative impacts on our collective mental health is becoming clearer, and that's the focus of today's session. So today we're joined by Yolanda Lear, an author and community advocate for mental health. She works with the Cool Down Cafe, which is a youth-led project run by peer mentors and psychologists. They work together to create a safe space for 11 to 18-year-olds to help them with their mental health. Another special guest is Dr. Sally Slotovitz, who's clinical and community psychologist and CEO of the youth charity based in London called Art Against Knives. Now, Yolanda and Sally will join us for a discussion on the impact of coronavirus on community mental health in just a moment. But before we get to them, let's go to Dr. Kit Yates for the latest numbers.
Great, thanks, Alok. Hopefully you can all see this on full screen now. So it's a bit of a mixed week this week in terms of cases, hospitalizations, deaths, and vaccination. So that's what I'm going to take you through in that order. I've only got 5 minutes, so I'm going to try and be brief and get as much information across as possible. So starting with cases, we have seen a big peak in cases and it is now coming down. I think there's no doubt now that this fall in cases does genuinely reflect a fall in infections. But if you look more recently, if we zoom in on the last couple of months, you can see two things. Firstly, back in May, we had extremely, which was very good news. And then we started to open up. We pushed R back above 1. And now, even though quite sharply for a few weeks, we're starting to see a plateauing in terms of case numbers. It's starting to flatten off as of the last week or so. So looking at the 4 nations, looking at cases per 100,000 people, this plateauing isn't quite as evident, but this data is a bit lagged because it's reported by specimen date rather than by the date in which cases are reported, which is what I showed on the previous slide. So here, though, you can start to see in England in particular, this slowdown of the decrease. It's starting to slow down. And I expect when we look at these same figures next week, we'll start to see this plateauing, the reported cases as well. And you can sort of see that in Wales as well to a lesser degree, but perhaps not so much in Northern Ireland, although their cases are at least coming down. Similarly, with positivity rates for the 4 home nations, you can again start to see this slight slowdown in the rate of drop, although in each case, the changes in positivity were never quite as dramatic as they were in cases, never got quite as high, so it isn't coming down from as far. But you can see things starting to slow down. And again, this only goes up to about a week ago, so we might expect to see it flattening a little bit more when we look at these same data next week. Positivity rates are still, I should emphasize, still quite high, as are cases across the UK. We're averaging between 25 and 30,000 cases a day, which is still an extremely high level of cases, unfortunately. Just breaking that down into the English regions, it's a bit of a mixed picture. Again, you can see most regions have been falling sharply, but now we're starting to see flattening off in a few regions. This is Yorkshire and the Humber, and in the southwest as well. That's in terms of cases. In terms of positivity, you're starting to see that in a few other regions, that just in the last couple of days of data on here, which corresponds to about a week ago, we're starting to see a flattening off across the regions. And this is probably, all of these flattening offs are probably to the loosening of restrictions from the 19th of July. So there's about 12 days between the 19th of July and this last data point, and that's about the sort of time that we would expect to see cases coming in from loosening restrictions. So we need to monitor this very carefully, because it looks like we could be at a turning point where we maybe start to go up. Even if cases stay at these sorts of levels, that's a high level of cases in the community. The ONS report that came out today suggests that 1 in 75 people in England had COVID last week. So that's still a large number of people getting infected and having COVID. Just break the case figures down by age very briefly, we can see that actually for the under 20s, in all regions, the numbers are falling, which is good. And I suppose this reflects the fact that school children are not in school and haven't been for the last few weeks. So that's good news. Slightly more worrying is the 20 to 60-year-olds. These are the people we'd probably expect to be most impacted by the loosening of restrictions on the 19th, people who are going to be going out to work more, socializing more. And again, you can start to see this plateauing and maybe even increase in some regions, certainly not falling as fast as they had done, apart from the Northeast is still falling relatively rapidly. But you can see most of the regions are now flattening off in terms of their cases in this 20 to 60 age range. And the good piece of news is that for over 60s, we're still seeing consistent falls, maybe at a slightly slower rate, but also that the y-axis here is at a lot lower. So these case rates never got as high as they did in the younger age groups. And that's obviously good news because these are the people we're most worried about getting COVID. They have the worst potential health outcomes from getting COVID. So that's cases. Briefly on hospitalizations, we're now starting to see falls in hospital admissions, which is really good news, reflecting the falls in cases we've been seeing for the last few weeks. So if there were any doubt, this puts the final nail in the coffin that genuinely infections have been falling. And if we look at occupancy, that's now starting to plateau. So again, it has been rising following the rises in admissions, but now that's starting to plateau and hopefully will start to come down. But again, there is pressure on the NHS at the moment. We're still hearing reports of hospitals, ICUs under pressure. And if cases plateau or hospital occupancy plateaus at this level, then that's not good news. We'd like to bring that down so that we can treat people with diseases other than COVID. The last point I want to make on these figures is about deaths. Of course, deaths are lagged from cases. In this last week, we reported 571 deaths due to COVID, people who tested positive 28 days prior to dying. And we're at the highest rates we have been since mid-March. And it's so easy to forget because people get caught up in celebrating the fact that cases are coming down. That's really good news. But actually, these deaths are reflecting the high levels of cases that we had a few weeks ago. And if cases plateau at a high level, then we will see deaths plateau at a relatively high level as well. In this last week, we've seen at least 2 days where we reported over 100 COVID-related deaths. So it isn't over. The link between cases and deaths is not broken. And if we maintain high levels of cases, then we'll see high levels of deaths. Hopefully, we can avoid that by vaccinating as many people as possible. Vaccination has slowed down significantly. I'll show you this first. In fact, you can see that it's continuing to slow down. We're doing fewer and fewer first doses, although second doses are remaining roughly constant. That's partly as a result of coming towards the end of the program. Good news is that JCVI have approved vaccination for 16 and 17-year-olds, so we hopefully will up these figures a little bit. But if you look at the proportions of people fully vaccinated, we've still got 40% of people who haven't had both doses and probably 30% of people who haven't even had a single dose. This is including children here. So there's still more work to be done on the vaccination front. So I'll just summarize by saying case numbers are still falling, but it looks like they may be starting to plateau in terms of positivity, in terms of the cases across different regions in England. Hospitalizations are falling, which is obviously good news. That reflects falls in cases, but there is still pressure on the NHS because occupancy is still high. We'd like to see that come down more. Deaths are still rising as a result of the rises in cases. And again, if cases plateau at a high level, then we'll see deaths plateau at a high level. Vaccination is slowing down. We'd like to up this again. The more people we can vaccinate, the less transmission there'll be, the less cases, the fewer cases, the fewer hospitalizations, and the fewer deaths there'll be. So I'll finish there and I'll pass back to you, Alok. Thanks.
Kit, thank you very much indeed for that. Some positive news for a change, which is good. Now I'm going to ask Professor Stephen Riker to introduce his guests and lead the discussion for the next 20 or 30 minutes.
Thanks. So today we're returning to the issue of mental health, and I'm delighted that we are, because it's clearly one of the key issues in the pandemic and very often is overlooked when we look at the impacts and the costs of COVID over the last 18 months or so. And today, in particular, we're focusing on mental health from a community perspective. Very often when we think about mental health, we think about it in terms of individuals and individual therapy, and that's of course important, but at the same time, the impact of the pandemic is filtered through the communities in which we live. And different communities have experienced the pandemic and have been affected at the level of mental health in very different ways. And so it's very important to address that community level. But community isn't only a problem, communities clearly is part of the solution. And I want to discuss with our guests the issue of how communities have been responding, what they can do, how they can be part of dealing with these problems of mental health. And as you've already been told, we have two guests. One is Yolanda Lear, who is a community activist and is involved in community initiatives to deal with mental health. And the other is Sally Zlotovich, who is a community and clinical psychologist. There are many things I could tell you about Sally, because she's been very active, a co-chair of one of the British Psychological Society working groups on community resilience. She's a co-founder of Psychologists for Social Change. And so can I start with you, Sally, and ask you to talk a little about the ways in which the pandemic has impacted on mental health at a community level, and the ways in which different communities have been affected in different ways.
Sure, thank you, and thanks for having me today. Yeah, I mean, obviously, before I start, when we talk about mental health and well-being, you know, it can bring up a lot of things for people. So I want to acknowledge in advance that some of what I say can be difficult if we're talking about particular experiences. So people, please look after yourself out there if you are experiencing any of these things. And of course, whenever we're also talking about numbers and groups, it can mask the suffering that lies underneath it for people. So I just want to acknowledge that now. And when we are talking about numbers, that I recognize wholly that these are people's experiences. And there's many people's suffering that haven't even been seen and witnessed. So just to share that first of all. And of course, all of us have been affected. Our psychological health has been affected by the pandemic. There's no doubt about that. It's to some extent a normal response to loss and to change that we've all experienced through the lockdowns as well as the illness itself. So we'd expect everybody to have some sort of reaction and then a recovery from it afterwards. In fact, the Health Foundation have said up to about 70% have said that it's impacted on their mental health and well-being. But yeah, as Stephen, you were just saying, I think what's important to recognise is we often think about mental health as an individual problem. It's something in our brains or our minds. But actually, there's huge impacts through the community level factors. As a psychologist, we tend to think of risk and protective factors for mental health. And the individual factors are only part of the story. So the other part of the story that's often left out is things like, who's in your community? How do you get along? Is there good trust? Is there a sense of belonging? Do different people have different senses of cohesion and trust with each other? Do people have different levels of experience of neighborliness and those kinds of people relationships in communities? The other things that affect things at a community level are, what's your place like? What resources does it have? Is it as wealthy as some areas, or is it experiencing deprivation? And why is that? And what's happened in the community historically? How is that affecting people's sense of connection to their place and their resources in the community? And then there's a really big power issue. So some groups of people have more sense of agency in their community. Some people are more involved in local decision making, for example, or feel like they know how to get involved in decisions, whereas other groups of people really experience things being done to them quite often. And there's a really great Doctors of the World report, which I've used a lot recently, which is for it talks about the impact of the COVID on the really excluded groups like refugees and asylum seekers, people who have no recourse to public funds, the homeless, sex workers, many people that you wouldn't even consider how this has impacted on them. And there's so many barriers and issues relating to those groups, very excluded groups, and their mental health and well-being. And then there's also other groups and communities that reflect previous structural inequalities, which very much align with probably what you've discussed here before around health inequalities, the wider health inequalities of COVID. So racialized communities and communities of colour have experienced worse mental health impact. So have women, so have renters and people who don't own their own houses and those sorts of issues. So I can go into a lot more detail about some of the reasons why those things are, but they ultimately, the mental health impact is closely aligned to who was struggling with adversity beforehand.
But so let me push you a bit on that, because I think it's very interesting to ask, well, what are the key factors which lead to different impacts on different communities? Because when we talk about the impact of the pandemic, often we conflate very different things. We conflate the anxieties of how the pandemic will impact on us economically. We talk about the trauma and fear, either of getting infection, of having got an infection, of relatives dying. We talk about the difficulties of isolation, especially under conditions of lockdown. I wonder if you can speak just a little bit to the importance of those different factors at a community and at an individual level.
Yeah, sure. So I mean, again, it's really, as you were just saying, it's really complex and multifactorial. There's no one thing, but there's very common themes. Poverty and unemployment and financial insecurity are really key issues towards people's mental health and well-being. And that was true before the pandemic. It often doesn't get spoken about in mental health services, for example. But as a child, for example, you're way more likely, like 3 or 4 times more likely to experience mental health problems if you're in the 20% lowest income household. And that's simply because of the stress and difficulty associated with living in poverty. It's just really, really hard, and everything it becomes so much more difficult when you don't have access to resources and you're living from a hand to mouth. And that includes, of course, and we've heard a lot about this from people like Marcus Rashford, about food insecurity and the impact that can have on children. We talk a lot in our network, Psychologists for Social Change, about the ways some of these issues impact us psychologically. So the increasing use of food banks, for example, is connected to more shame, more humiliation. Well, a lot of what underlies mental health problems is deep sense of shame and humiliation. So if you're increasing that at a population community level by people feeling stigmatized, by not only perhaps finding things difficult, but also then having the stigma of going to a food bank, for example, then that's the sort of thing that contributes. But there's other more indirect things that you might not even think of, things like digital exclusion, and for some groups where they access specific culturally specialist support, like refugees and asylum seekers, for example. A lot of places have been closed because of the pandemic, so they might not be accessing specialist support in the way that they were before. So there's those sorts of access to support issues. There's mistrust of professionals, by many, and I'm sure many of us can speak to this, but it's really an issue around misinformation, of course, but also for some groups like refugees and asylum seekers who are very marginalised, their fear that their status as immigrants will affect what happens to them and their capacity to carry out the guidelines that have been recommended, for example, if they're living in overcrowded conditions, as many people are. And overcrowding and poor housing is another example of why people might feel more anxious than other people who don't have to live in overcrowded conditions or don't have access to green spaces and safe spaces that other people have. So they're just some of them.
Yeah, thanks. We could, of course, discuss this for hours, but sadly we don't have hours. Yolanda, can I come to you? And I wonder if you can talk to us about, as I say, the impact of the pandemic on mental health, on young people, on deprived communities. What does it actually mean in terms of people's lived experience?
I think it's difficult to, as you said, just narrow it down to like one or two kind of examples. But being a youth leader and a peer mentor, some of the challenges that I've seen, especially in young people, the things that they've had to face. For example, during the lockdown, working from home, majority of people don't even have the facilities to actually work from home. So that obviously limits how much they can do, which again will bring forth some of the financial difficulties that Sally spoke about. Also, things like not being able to even just see your family or go spend time with your family. That's a big thing for like people within our culture. A lot of us have huge families, and not being able to go down the road. Like for me, my sister lives across the road from me. My mum lives like 5 minutes from me, but not even being able to go and see and spend time with certain family members, that affects us, well, not just us, but a lot of people mentally, because that families tends to be your support, whether it is just with mental health, finance, just any kind of support that they can give, whether it's love, you tend to turn to family to get that. And having that restriction, especially when you're young, not knowing really where to turn, and then obviously you see in schools, they might not show you the same love, respect. Even in your community, you might not get the love and respect that you would get from your family. So you're kind of left to just fend for yourself in a sense of still trying to find that love, self-worth, all of that. So yeah, there's quite a lot in that aspect. I'm thinking other examples as well, like people that I know that going to uni, for example, they're unable to actually fulfill certain tasks. Is that the right word? Assignments that they've been given because certain restrictions on equipment or even just access to internet, those sort of things, they're unable to get because of obviously the lockdown, the pandemic. Even like, not to put myself into example, but even for myself, I've got other like hearing problems basically, and usually I'm supposed to go every 6 to 9 months for a checkup. I couldn't even go to do that because of the pandemic. So things like that, a lot of people have had to put other health issues on hold because of that, which obviously for myself as well caused quite a lot of problems when it comes to mental health as well. Yeah, I think I answered.
No, you did. Wonderfully rich. And again, I wish we could have more time to explore it. But I want to turn to the other side of the story, that, okay, there have been problems for particular communities, but equally that the using community and communities can be part of the solution. And I know you're involved in one project, which is about creating safe spaces for young people and helping them deal with mental health problems. I wonder if you could tell us a little bit more about that and how it works, and any examples of how it has worked for people.
Yeah. So I might have the pleasure of working alongside Sally with a project called Cool Down Cafe, which is, as you mentioned earlier, it's a safe space for young people aged 11 to 18 to actually come. Originally, it was all over Zoom because of the pandemic. Everything was Zoom, but we actually managed to get some young people joining. Originally, everything was kind of based around my book to start with when I first joined anyway, and just creating workshops that get young people to kind of open up, speak about issues that may be affecting them. So Sally mentioned about the food bank issue and how that has affected, I guess, a sense of pride as well. We had young people speaking on that, speaking about how it made them feel seeing their friends go into a food bank or seeing their family kind of struggle. So just to have that kind of space where they can open up and speak on issues that they might not necessarily feel comfortable speaking on, even at home or at school. the peer mentors that run it are aged 11 to 25, even though I'm older than 25. But that's the age group really that's supposed to be running it, and they work alongside some psychologists and other youth mentors as well. So it's mainly youth led. So we try and create an environment where it's like a brother sister looking after the younger generation, but just supporting them basically. So that's basically the Cool Down Cafe. I'm trying to think of, at the moment it's actually on pause because we're struggling to get some young people to come, and I think it is that aspect of just speaking about your mental health as well. It's not always easy for young people to do, and it's quite a frightening thing to actually open up and speak about. But I guess that's where like the Cool Down Cafe and working with the peer mentors that aren't too much older than some of these young people can kind of draw them in and support them and show them that you don't have to be ashamed to actually speak about your mental health. It's nothing to be ashamed of. So yeah, that's basically the Cool Down Cafe.
And do you think, the fact that people were going to talk to peers, people close to them in age and close to them in experience, made them willing to go to Cool Down Cafe in a way that they hadn't accessed other services?
I think so, because I think it makes it more relatable when you have people that's not too far off your age group, but going through similar situations as well. And obviously we can open up and kind of speak on some of the issues that we're facing, coming from the same backgrounds, the same area as well. And obviously going through the pandemic and the lockdowns with them, we can see the impacts it's had on us. So obviously we can give them a lot more support. And as I said, it's relatable because we're similar in age. No offense to obviously the older people that work with us, but I mean, you already know young people like to talk to young people. They're not really going to speak to someone, or not going to feel 100% comfortable speaking to someone who's a lot more older than them, or maybe not from the same walks or backgrounds as them, and then open up about their mental health. So to be able to have that kind of organization or project running where they can just kind of drop in when we have our sessions, they don't have to come, but we encourage them to come. And just to know that it's not something that they have to do, but they can do if they want to. I think even just that in itself is quite a big thing for the young people.
So I know we're running out of time. I can see Alok beginning to twitch a little bit, but I do want to come back to Sally and ask one final question, which is, I mean, in many ways, what the pandemic has done is it has revealed to us the inadequacies of our services in so many ways. And it tells us what we need to do if we are to rebuild in a way that can deal with these problems. So what, Sally, do you think we've learned about mental health and mental health services from the pandemic? And what do you think we need to understand about the delivery of services, and perhaps changing the delivery of services and the nature of services in the future?
Great question. I could spend ages talking.
You've got 3 minutes.
I mean, we've learned these lessons over and over again from marginalised communities already. They tell us in different ways when you work alongside them that the services are badly designed for marginalised groups, and that's not, of course, for many people they work well. Although at the moment I'm not sure about mental health services generally, but certainly by working alongside people like Yolanda, I learned so much about the struggles that young people, for example, are facing, and it's the issues of racism, which, for example, are very hard to narrate and bring to present in mental health services and individual therapy, for example, because it's mostly white people leading them. Once you're in partnership with marginalized communities, or there's peer support, or there's something called co-production, which is about when you work with the beneficiaries themselves to design and deliver those services, creating employment opportunities and creating opportunities for them to change the social conditions in which they're living in. That's when we start to get to really reach and work together to sort of improve the community conditions that we all live in. Because yes, as we've heard, people start with different degrees of respect and sense of belonging in their community and feelings of trust in the first place. So we need to be thinking as a mental health much more broadly than just how can I help you think differently about what's going on, but how can we create the conditions to allow people to thrive and for communities to thrive.
That was a lot packed into 3 minutes, so thank you. Before we finish, I just want to see if there's anybody else on the panel who has any question they would like to ask, either Sally or Yolanda or both.
Yeah, I've got one, Steve.
Thanks.
Really great presentations. Thank you both. I mean, what strikes me is the difference between the kind of society we're living in now and the one that would really foster good mental health is quite considerable. And you both went through, lots of those different aspects of it. And, we all feel sometimes quite powerless to change things and to make a difference. So I was wondering what you do to help encourage people to feel that they can make a difference, and what sort of directions you point them in so that they can see that they can make a difference, because that in turn is so good for mental health.
Agreed. Well, I'm just going to big up Yolanda a minute as well here, because what Yolanda does is not only is she involved in Cool Down Cafe, she's also involved in other political and social action groups locally. So maybe she can speak to that. And that's certainly something we encourage young people at Art Against Knives to get involved in changing their social conditions, in speaking out, in having their voices heard. As you say, Susan, it's very much civic activism, civic engagement, participation is really good for your well-being and sense of agency. Yolanda, do you want to add anything about your experiences, or anything else you want to add, obviously?
I think the best thing for me, like I always encourage people, is just get people doing things that they love to do. So for myself, what helped me get out of a lot of the battles that I was facing is I do poetry. I'm a writer and rapper, and I do a lot of writing basically. So even just me writing the book that I did, which is based around overcoming mental health. So it's a journey that you would actually take to overcome it. But even just doing the writing just helped me mentally, because it's something that I generally love to do. So especially when we're working with the young people, I always try and find that early intervention kind of platform. So get them doing things that they love doing. And even if it's not early intervention, even if it's you find that they are generally struggling with their mental health, getting them to focus on things that they're thankful for, they love doing, or just things that bring more of a positive side to them, or just positive helps a lot. So whether that's going on bike rides with the young people, or just people in general going for a walk, playing music loudly, even just shouting and screaming and getting it all out of you, it helps. But just to help support them doing the things that they love makes a very big difference. Because I think when we rely on the services that are already out there, we're not focusing on how we can genuinely help them. We tend to focus on how can I put this in a way that it actually makes sense? We focus on the issue rather than the solution, if that makes sense. So rather than when young people come and say they might be struggling with their mental health, we tend to look at the mental health side of it rather than the individual as a person and what they love to do and how we can help support them as an individual, rather than look at them as, oh, you are depression, or you are anxiety, or you are schizophrenic. Like, we look at them as you are a human being, you are a young child, you are a young female, you are a young male, and I can see you for you rather than I see you for what you're struggling with. So it's just getting to see them as a human being and get them to see themselves as a human being, and just get them doing things that they love. I find that always helps, especially for myself anyway.
Thanks, Yolanda.
So, I'm afraid we're going to have to draw this to a close. I mean, personally, I'd be very happy to take up the rest of the session, but I might be outvoted on that. And I think it's just so powerful. And I think it's one of the strengths of these briefings that not only do we bring the figures and the statistics, which are important, but we also, and in particular from Yolanda and from Sally, bring home the realities of what COVID and its consequences mean in terms of everyday lives, and why it's so important to get on top of the pandemic. So Yolanda and Sally, please stay on the panel, because I'm sure there are going to be more questions about mental health. And I'm going to give my apologies because I have to go to another meeting. But thank you so much for that. I found that really powerful and very moving indeed. So thank you.
Stephen, thank you very much. And thank you to Yolanda and Sally as well. I feel like we can talk about this for the next half an hour at least. So there'll be lots of questions that will come up from the audience. Now, the first person on the from the member of the public who's going to ask a question is James Ledbetter. I feel like perhaps some of your question has been answered in that very rich discussion, but James, feel free to ask your question or tweak it if you like to ask some more.
Hi. Yeah, I guess my question was about the impact on young people of yeah, so if lockdown and COVID policies have really impacted young people's mental health, how specifically can CAMS, Child Mental Health Services, help young people during this time?
Okay, who do you think would be good to? I think Sally probably would be good to start with you on that.
Okay. So I guess, I mean, one of the issues, I don't work in the NHS anymore. I work for Art Against Knives, actually, which I'm about to put a link in. But I think the issues that I hear a lot about are waiting times and thresholds. They seem to come up an awful lot. And then also for sort of more of the marginalised communities and groups, and marginalised young people, it seems to be whether they see representation of their cultural background and ethnic background in the people that they work that are working at CAMS. It often comes up. And that's why sometimes community initiatives and community organisations and the voluntary sector actually often work more closely with those groups. So I assume that a lot more funding needs to be put towards both CAMS and in children and mental health services, who need to also work differently in terms of co-designing and co-delivering with young people to really get the up-to-date experience of young people. And I know that is in the NHS long-term plan. Co-production is part of the NHS long-term plan, but it needs to happen a lot quicker. There's a lot that needs to happen in order to enable that to happen, if that makes sense. The infrastructure and governance side of NHS needs to be more agile, be more flexible and updated. I know these are sort of behind the scenes questions, but for young people accessing those services, they just need to be able to access them at the point in which they're in a lot of distress. And that's the key thing for most parents and families and children and young people. And that can only happen if there's more and more support put into those services. They're more easily accessible. And then they need to also work more closely to ensure that they are meeting mental health inequalities. They need to work more closely with potentially with the voluntary sector and marginalised communities themselves. I hope that answers a little bit.
Thank you, Sally. Does anyone from the panel have anything to add, perhaps, from their own experiences working with mental health or children or the NHS even? No. Yes, and Nancy, please.
Yeah, I think just kind of back what Sally said, working with like Cool Down Cafe, I realised how important it is to have like peer mentors or youth leaders working alongside specialists in those kind of settings, because one, you're more than likely going to get young people to actually be willing to access those services, and two, they're more than likely going to actually stay if they see young people that can support them as well as getting the help mentally. Obviously the waiting time is a very big issue, even for myself. As part of the reason why I didn't go and get that kind of support from NHS is because of the waiting time, and also the self-referral element to it, especially for like, I don't know how it works with younger people, but as a young person, when I did try and go get that support, having like a self-referral, for me, it didn't really help. It didn't make sense because mentally, I wasn't even strong enough to just about go and get support from my GP, to then have to go sit down and log in online and refer myself as well. I didn't think that aspect of it was suitable for young people. So I think maybe it just needs a whole new change to the system and how they actually do things, to be fair. But I think if they can incorporate some form of peer mentor support with the works that they're currently doing, they would attract a lot more young people, especially from communities like Hackney in itself, or more deprived areas, just because they know like they're going to have someone within their age group, they're helping them as well. That makes sense. Yeah, I don't want to go take up too much time, so I'll pass it back.
Thank you, Yolanda. That was really interesting. And you're not taking up too much time. It's always good to get these experiences. I'm going to move on with the questions. We've got Nigel Nelson from the Sunday Mirror who'd like to ask a question. Nigel, over to you.
Yeah, thanks, Alec. Slightly, well, a different subject really, but can you get flu and COVID at the same time? If so, what's the effect of that? And would there be any benefit of flu home testing kits this winter?
That's a great question, Nigel. That's a fascinating question. I'm sure I can see about 7 people who want to answer that question. So which one of you virologists wants to take it? Dinan?
Thanks. Hi, Nigel. No, great question. And clearly, there's a lot of concern about the increasing risk of other infections as we come up to winter. As many people now recognize, the social distancing during the last winter has actually significantly reduced infections such as influenza, such as respiratory syncytial virus, and other infections from spreading that would normally spread. And so we are expecting a sort of rebound as the population immunity has waned to those infections that would normally be experienced most years. So it's going to be an issue. Can you get infected by two viruses at one time? Well, interestingly, in normal winter times when laboratories in hospitals will be testing the sort of swabs that are taken for COVID that we all know, nasal swabs and throat swabs, to diagnose specifically viruses, not uncommonly, you get 2 viruses being detected in one swab. So it's not unknown that 2 infections can happen at one time, but it is rare. And in general, what happens to the body, once the body sort of responds to one virus, it makes it less likely another virus can infect straight away because of chemicals such as interferons that the body responds to. So I think that having 2 infections at the same time is unlikely, and of course we're yet to identify that, and we don't test for that in swabs for COVID. But it's more, I think, a bigger issue is that how we distinguish between these infections that can give very similar symptoms: cough, fever, runny nose, and as we know, there are an array of symptoms associated with COVID. So I do think there needs to be a quick development, as the Academy of Medical Sciences report the other week has identified. We need to start to extend our diagnostics. And of course, for influenza, it's essential that immunization is taken up. But there are, of course, drugs available for those who do get to a risk of severe influenza disease. So for all those reasons, I would fully support there being a widening of diagnostics on top of the testing for COVID. Thanks.
Thank you, Dean. And that was a pretty comprehensive answer. Nigel, is there a follow-up you had, or was that enough for you? Because I'd like to get through some more questions, but I'd like to give you a chance to follow up if you've got anything.
No, that's fine. Thanks very much, Alec.
No problem at all. Okay, so unless someone else on the panel wants to add some extra virology on top of Dinan's, which I think would be quite admirable, then I'm going to move on to another question. This one's from Bonnie Grotjan. Are you there, Bonnie?
Yes, I am. Can you hear me?
Yes.
Yes. Okay, brilliant. Thank you. I've really appreciated the discussion so far about the various aspects of the various aspects of the pandemic that have had an impact on people's mental health, and people have touched on issues of trust and power. So my question is sort of connected to this. Have any studies been done looking at the specific resulting effects on mental health from people either trusting or not, or respecting or not their country's governments and how each country's leadership has responded to the pandemic. In other words, how much can mental health be affected by the quality of someone's relationship to and trust in their own government? I'd be interested to hear about anything people know about this either in the UK and beyond. And please, if the special guests wish to speak to their own personal experience, that's fine too.
Thank you, Bonnie.
Thank you.
Now that's quite a complicated question, but I'm sure someone will take it on. Who would like to? Yes, Anthony, please.
Bonnie, that's a great question. I can't answer it actually in terms of a study like that to look at a correlation. What I would say, and it links a bit to your question and also to the mental health impacts, is the causes and the core of the causes. And what's worrying me greatly at the moment, which I'm sure will further diminish trust, certainly by the poorest sections of our society, is the fact that this £20 reduction in universal credit drops the income of people under 25 joint claimants by 18%. And it drops over 25 by 15%. Added to that, we've got 2.5% food inflation right now. And this means, I mean, we've had bank usage go up by over a third over the past year. And we've seen destitution rates double, more than double, since 2019. And on the 2019 figures, I found that 2.5 million people had experienced destitution in that year. That means going without the essentials we need to eat to stay warm and dry and keep clean. And so we could be looking at 4 or 5 million people in the coming months or more suffering periods of destitution in our country. And that will have a huge knock-on effect. Now, the problem is that a lot of those people in the poorest groups are not necessarily got voting power. And they will have lost trust in all governments because they're always in recession. They're not just experiencing a recession now. So I think those are issues that all of us should be taking up with our MPs and putting pressure on, because to me, it's almost criminal to be cutting the lifeline to some of the poorest people in the country. And children, especially, I mean, 1 million children are getting food parks a year. This is, it's devastating. And we're one of the 6 richest countries in the world. So I haven't answered your question about the relationship between trust, but one does know that trust in government does fall. And I think this government risks a huge fall if they go ahead with this plan. Thank you, Anthony. Susan, did you want to add something?
Yeah, again, I can't give you any chapter and verse in terms of publications, but I'm part of a Lancet Commission on COVID, a public health commission. And as part of that work, we've had presentations from people leading public health responses in many countries around the world and been looking at patterns. And one of the things that comes through really clearly is those countries that have done well in terms of minimising the disease and death are those which have trusted governments. And one of the things that's very clearly associated with that trust is governments that speak directly to the public. They have officials speaking directly in a very clear way. So, communication is very clear. People know where they stand. So I think this is a really important area to collect data on. Maybe people are out there and I don't know about it, but it's something we definitely wondered about and thought how we could do it, but it's not an easy job.
Okay, thank you very much. Martin, a quick point from you, and then we'll move on to another question.
Yeah, so there is at least one small study from the US which shows that decreased trust in government is associated with increased psychological distress, and that's mitigated or mediated by the individuals feeling that they're in control or they're able to take control of the response to COVID. We've done quite a lot of work looking at this issue in previous crises, the post-Soviet crisis, the global financial crisis. And what that shows is that people living in countries where they feel that they're being left behind, they're ignored, by their governments, you tend to have an increase in suicide. So, for example, you see that in countries where often you have an association between job loss and suicides, but that link can be broken in countries where there's a high level of trust in the authority and where the authorities are putting out a signal that they actually care about people. They're investing in what we call active labour market programs, getting people back to work and so on. So there is some evidence we can draw on from previous crises that I think may be relevant.
Thank you, Martin. Just because we don't have a huge amount of time and lots of questions, I'd like to try and keep it quite pacey. So let's get on to the next question from Zach Graham.
Hello, can you hear me?
Yes, I can hear you, Zach.
All right. Thank you for this opportunity as a 13-year-old to be heard, but please bear with me. It will only take me a couple of minutes to make my important points. As an adolescent with underlying medical conditions who catches usual viruses easily, I was scared to go back to school in September. I managed 5 days back until I caught a usual virus. I got really poorly, required medical intervention, and was symptomatic until November, and off ill for most of September, with tons of work to catch up on in my free time. Some who don't suffer like this or know what it is like to struggle for breath don't fully understand the fear, anxiety, and effects on my mental health. When children hear that COVID doesn't affect them, it makes many pay less attention to mitigations, as some incorrectly think that children aren't affected. After the second lockdown, all students were asked to wear masks, which helped a lot. After 18 months of affected education, for me having been off ill 3 times with viruses in a year, I'm sure you can understand my desire not to catch COVID. Come September, school guidelines in England state it's business as usual, with all mitigations gone, no masks, no bubbles, no distance, no staggered start and finish times, no one-way systems, no air filters, and changing together for PE, everything as normal, when we are far from living in a normal world, especially with new rules indicating that a teacher with a COVID-positive child can still teach me. With most over 18s vaccinated, this has to be the most dangerous time ever for kids in school, as the virus jumps to those unvaccinated. Unbelievably, there is still no choice of a vaccine for me, or those like me in the UK. Only some vulnerable cases are allowed vaccination. I watch millions of others my age in other countries get vaccinated. All I feel is despair. My questions are, how is this a safe environment for children to be educated in, especially for those with underlying health conditions and disabilities? And why are those aged 12 to 15, who are the kids in busiest school environments, not being given the choice of a vaccination now, and when it's been regulated here for my age for...
Zach, thank you very much for sharing your story so eloquently and for your questions. Obviously something that a lot of children probably are concerned about. I feel like a lot of those questions are things that perhaps should be directed towards politicians who make these decisions, but I wonder if someone on the panel just has a thought how Zach might take some comfort from the things that are going well, or are there things that he should be doing or thinking about that you might be able to give some advice on? Who would like to just, there's 3 of you. Would you like to make your points relatively quickly? Zubaida, you start.
Well, Zach, I mean, I have to say that is the most articulate way of expressing the absolutely dire situation that you've been in, and that children like yourself and many children have been in throughout this entire pandemic. You've been at the brunt end of this pandemic, and I'm so angry on your behalf that the government haven't recognised that each time they've had an opportunity to do something, like last summer, like Christmas, like this summer, they're not only not doing anything, but they're going the other way where they're releasing all restrictions. And I'm really, really sorry to hear that you had to struggle through that. I share your anger that the JCVI have decided against vaccinating 12 to 15-year-olds, I am just as bewildered and just as angry as you are about why they've taken that decision, because they don't need more data. Countries throughout the entire world, like Israel, Japan, US, Canada, France, Germany, countries throughout the world are vaccinating 12 to 15-year-olds. There's so much data. In the US, we know that, over 8 million children under the age of 18 have been fully vaccinated. There is no reason why you can't be protected. And if it is the case that there is not enough supplies, we simply don't know if there's not enough COVID vaccines at the moment for children. If that is the reason, or whatever the reason, why isn't the government making schools safer? And they should. You're absolutely right, Zach. They absolutely should be putting in more restrictions, because as Kit said at the beginning, over 20,000 cases a day is extremely high compared to May and earlier on this year, where they were well under 2,000. So something should be done, and hopefully something will be done to protect you, Zach.
Thank you, Zubaida. And there are questions also down from the members of the public about how to make schools safer, which maybe if people have got some thoughts on. Zubaida, you just mentioned some of the things there, but if anyone else has any thoughts on the kinds of things that schools might do to make classrooms safer in this situation that we find ourselves, that'd be very helpful. Anthony?
Well, actually, I was just going to make 2 quick points. One, I would say to Zach, that was the best question I've heard ever since we started this. It was articulate, it was brilliant, and I share your pain. I think we all do. We believe you should have access to a safe vaccine, which it is. I just ask for your permission, actually. Would you allow us to be able to retweet the clip of your question? Because if we all do that, we may get your voice heard more widely. And that is very powerful when it comes to, affecting political decisions about spreading this, because voices of young people are not being heard. And finally, I would suggest you do go and talk to your GP, because within the vulnerable, I'm not sure how much flexibility there will be between now and September about people in your position getting access to a vaccine.
Thank you, Anthony. If you're okay with that, Zach, do put your fingers up, the thumbs up, or we can talk to you later about the clips. Christina, did you want to add something quickly?
Just on what schools can do to make environments safer. So I think in the Republic of Ireland, they are now putting carbon dioxide monitors in schools and guidance on how to use them. So if they show that levels are too high, how you ventilate, how long you have to ventilate rooms for, and so on. And also you can provide portable HEPA filters which clean the air, and it all just makes transmission of COVID less likely. So that's one way, that's something we could be doing, and we could be doing it right now. The other thing is just to say that there are rumours that JCVI will recommend vaccines for 12 to 15-year-olds in the coming months. I hope it's much sooner than months, but hopefully it will happen. I just don't think we can stay an outlier. I think other countries are doing it. I think we will do it. So hopefully it will happen sooner rather than later.
Thank you, Christina. Thank you for that. And ventilation, don't get me started. I've been banging this drum for a long time, and as I'm sure all of you have as well. HEPA filters, ventilation, this will help classrooms for no reason, no doubt. One final question before we have to wrap up, from Tracy Smith. Tracy, are you there?
Oh, yes, I
Hello.
am.
Yes, I can see you.
Thank you very much. Yeah, it's slightly different to the last question, I'm afraid. During the lockdown, it became apparent that touch is an incredibly important cornerstone of mental health. Could the panel perhaps comment on touch therapies and as an additional support in the coming mental health epidemic?
Very good point. Very good question. Does anyone want to talk about touch? Yes, Anthony.
Sorry, I can't talk about touch in adults, but I can say that as a pediatrician, there's been extensive studies over the years about touching of children and babies, particularly in the newborn period, how it improves bonding between parents, between the parent and the baby, skin to skin bonding. And even, for example, if you place children newborn infants on a lamb's wool mat if they're in an intensive care unit, it makes a very big difference to their growth and their tranquility and all the rest. So there's been a big literature on that in young children. I'm sure there will be a literature somewhere about the value of touch and massage and all of these things that so many people have missed. I think it's a very important point.
Does anyone else have a very quick point on that? It's a very, very interesting topic. No, and if it was Zaveda, please.
A more personal point, really, which is my mum passed away in January unexpectedly. Not from COVID, although that was initially the scare. And the first thing I remember thinking at the time was that it had been months because of the lockdown, months because of the city that my mum's from had repeatedly been in lockdown, that I touched my mum. And it's something in this pandemic that, you know, has been really stark, that with family members, with loved ones, with friends, that's the thing I think a lot of people miss the most during lockdowns, that you know, to be able to touch. So, you know, in that sense, I think it is profoundly important for most people, and it's what connects us to each other.
Thank you for sharing that, Zabeda, and I'm sorry for your loss. It's time to wrap up now. So I'm going to hand over to Sir Dave King to tell us what he's learned in the last hour or so.
Well, I think I only have a very short comment to make this time, which is related to the quality of the questions that we received. Now, we always receive very good questions, but quite frankly, as has already been said, Zach Graham's question was not only highly pertinent, very articulate, coming from a 13-year-old who is clearly suffering from the fact that he has underlying health conditions and a real worry about going back to school in September without access to vaccines in particular. So I thought just this high quality of questions. I loved the question from Bonnie Grosjean about the effect of trust in government on psychological health of the people. So I think the team always loves these big questions, these important questions, and I just want to thank those who contribute.
Thank you, Sir David. And Zach, I think that's your invitation to join Independent Sage if you wanted to do that, clearly. Thank you to our special guests as well, Sally and Yolanda, for sharing your stories and all your rich insights. This is a mental health issue that's going to continue for a very long time in the community, and it will be interesting to see where this goes. Thank you to the panel, of course, for your continued efforts and all your work. We'll be back at the same time next week, so see you all then. And if you've got questions, please do send them in beforehand. Meanwhile, stay safe and keep well.
Thank you.
Bye-bye.
Bye.